coming along this morning and attending. It's one of the biggest audiences I've had since my teaching days. Which were almost a lifetime away now.
I hope more people are going to listen today, though, Jim.
Oh, they never listen to me. Listen more now. It's occupational hazard. No matter the volume, sometimes you just don't get the communication happening. But along the way, the system works. Society progresses.
There's a fair bit of background noise. Can everybody put their microphones off apart from the chair as we get going? I'm hearing rattles and squeaks going on.
I'll take responsibility for that, David. Now, we may as well make a start in that case. No new attendees in the last 30 seconds or so. So welcome everybody to this meeting of the Southern Community Partnership, and very grateful for your attendance here this morning. And we hope there will be I'm sure there will be matters of great interest to you all, which we can discuss and shoot over and hopefully arrive at some actions thereafter, which is what it's all about. The next thing I have is apologies. Any apologies, Scott or Fiona?
Yep, we do have some apologies. Fiona Hampton, Heather MacDonald, Amanda Wagstaff, Angela Ekaverin, Councillor Richard Gale, Councillor Michael Beard, and Sarah Morrison.
Right, thank you very much indeed. Now we have an extended audience, so if we were to go around and do introductions, it would take quite a sizable chunk of time. So I would just ask you, please, if you're speaking, just to introduce yourself as you come on screen, and it just saves a lot of time as we try to get through this morning's business. My first duty is as Vice Chair is to introduce the new partnership chair. That's Chief Inspector Stuart Fitzpatrick. So Stuart, if you wish to kind of say a few words of introduction, that'd be very welcome indeed.
Yeah, thanks very much, Jim. Good morning, everybody. As Jim said, Stuart Fitzpatrick, I'm the new area commander, Chief Inspector for the North Highland area, which covers Sutherland as well as Easter Ross, Wester Ross and Caithness. So I've got to say that the Sutherland Community Partnership is by far my busiest area in terms of the community partnerships that are in my beat, and long may that continue. I'm conscious of the time that we've got a lot on the agenda, but I just want to say hi. I will hopefully try and drop into a lot of the thematic group meetings. So if you see me lurking in the background, that's just me jumping into the meeting to see what I can pick up and what themes are ongoing, what work's ongoing. And try and get up to speed as quickly as I can. However, all of my attendance like this one come with a little warning that I am still an operational police officer, so depending on what goes on, and today happens to be a particularly busy day, I may disappear from whatever meeting I am in, but I'm glad at least that I've made the start of the meeting, and hopefully I'll be here for the duration. Thanks very much, and I'll hope to meet everybody in face at some point in the future. Thanks.
Thanks very much, Stuart. And as I'm sure you're appreciating, it's quite a steep learning curve to get on top of everything that's going on. So it's well done on taking on the responsibility. Next item is minutes of last meeting, which look fine to me, but again, quite extensive. And are we quite content to accept the notes as being an accurate record of what actually was transacted on that day? Any voices of dissent? Okay, and thank you again to Scott and Fiona and David's team, without whom none of this would be possible, in fact, to keep the whole show on the road, plus support from Police Scotland as well. Next item is a public health item, private nature and health presentation. And Ailsa Villegas, as Health Improvement Team, I believe is going to take this particular item. Ailsa, is that okay with you?
Yeah, thank you very much. I've got a little presentation to share, so I'll just share my
thank you.
screen. It's lovely to see so many new faces today as well. So Can you see my slides? That's the question. Just give me a shout out if you can.
Yes, that's good with me.
Thank
Yep.
you. So good morning, everyone. I'm Ilse Viegas. I'm a health improvement specialist with the NHS Highlands Public Health Team. Some of you will have met me before because I've been working for the last 4 or 5 years on Green Health, which is about connecting people with nature for their improved health and well-being. We have a Highland Green Health Partnership that was formed back in 2018, which has got a mixture of public and third sector and bodies in Highland working towards this overall aim. We feed into the community planning partnership process through the Mental Health Delivery Group. And way back in the beginning, we did try to establish some pilot projects in Sutherland working around this area. And unfortunately, they were kind of cut short by the COVID pandemic and staff being redeployed elsewhere and just being spread a wee bit too thin. We weren't able to continue that work. However, we were able to deliver a number of projects in some of the other community partnerships. So I'm really just I'm here today to sort of share some of those lessons learned and also looking at where we can go together going forward by linking this agenda with nature, climate and health. So basically, one of the main aims of the partnership was to get more people outside more regularly. So back in 2015, the Scottish Household Survey showed that less than 50% of adults in Scotland visited the outdoors on a regular basis, and actually 14% didn't visit at all. Initially, the partnership was a physical activity initiative, but actually as it's grown, it's become a much more holistic approach, looking at people's mental and social well-being as well. There's a lot of evidence that shows there's a benefit for people's health in getting outdoors. There's also a lot of benefit for the NHS, and one of the drivers for this project is that from an NHS perspective, the prescription of medicines account for 11% of total health spend in the UK, and that's about £20 billion. And we're looking for alternative approaches to that to reduce the need for medication or postpone the need for medication, and nature-based activities can help with that. From an individual perspective, the average person in the UK only spends about 3 hours per year with an NHS professional, which leaves all the other hours of the years for self-care. And the Green Health Partnership has worked quite hard over the last 4 years in building capacity and giving people the confidence to do things to keep themselves in better health. I said the partnership met back in 2018, and originally we were a 2-year pilot, and it's great that we're still going 5 years on. It was funded through a programme called Our Natural Health Service, which came from the Scottish Government through Nature Scot. That funding is now coming to an end, but the Highland Green Health Partnership have agreed that they want to continue to work forward. So we've just reviewed our vision, and our vision is here for you to see. So by 2030, our vision is that the natural environment is valued as essential for the health and well-being of the people of Highland. We will work together to support individuals and communities to connect with and enjoy nature while safeguarding our natural spaces and promoting inclusion and biodiversity. So that came out of a conference we had in May, and we've also developed a new work plan to go forward. That is based around this framework, which I'll just explain briefly to help you see the sort of range of things that we're working towards. At the top there is the members of the partnership who feed in, but also really key to the success of this project is the communities we work with and the service providers in those communities, and also Highlands natural environment, as well as our public green spaces and the NHS estate. Overarching everything we do is this commitment to reduce inequalities, but also a new commitment to safeguard and enhance the natural environment. There's 3 pillars of work, and they're on a bit of a spectrum, moving towards a sort of population level, broad brush approach to preventative medicine, towards the right, which is much more individual, targeted interventions. So if you like, the right-hand pillar is more about treatments for specific conditions and formal referral pathways. In the middle, we have nature-based health improvement initiatives, and this is looking at all our wonderful health walks, therapy gardens, cycling projects that are out there. And over the course of the last 4 or 5 years, we've been giving small grant funding, letters of support, working with individuals on larger funding streams to ensure that these projects are continued and sustained. On the left-hand side is everyday contact with nature, which is much more around our public messaging, making people aware of the benefits and what's out there. So we have a website and social media and a communications officer that supports that. So what have we learned over the past 4 or 5 years? Well, we did pilot projects in Caerleon, Lochaber, Caithness and Badenoch and Strathspey. And we learned that there is no one-size-fits-all approach to this. There's a range of expertise out there being developed, and just as there's no one-size-fits-all approach in Highland, there isn't either across Scotland, as found out by Edinburgh Napier University. The programmes we put in place to prescribe nature have to really be tailored to local needs and the availability of local services, and everyone's come up with their own unique solutions to this. So I can only apologise that we didn't get to continue the work in Sutherland. But from the lessons that we learned in the other areas, we found that prescription programmes can be healthcare-led or community-led. Activities can be water or land-based, so we talk about blue health and green health. They can be group-led, or people can engage with these activities independently, which is particularly important for rural areas where there's a lack of organised groups. We've produced a number of tools and guidance for people to do things on their own. It can be active or passive. I said the start of the programme was about physical activity, but actually the benefits are there regardless of how active you are. So just sitting outside and getting a sunset is known to be beneficial to you. They can be at home or on your doorstep or in a dedicated green space. When the initiative was first launched by our Natural Health Service, there was this ambition that we would link people to national nature reserves for their activities. But what we found out in Highland was actually you don't need to go far to engage with nature. And actually, the average person in Scotland just lives 2 miles from a usable green space. And even those who are housebound or ward-bound can get benefits from bringing nature indoors. So we've produced a raft of materials to help people do just that. Can be targeted at a specific health need, a specific group. That might be things like a men's shed or a grief walk, or it can be open to absolutely everybody. And again, in rural areas, sometimes targeting can lead to stigma and lower numbers turning up. So all the benefits are universal regardless of what condition that you're going for. And again, specifically for Highland, maybe not so much the rest of Scotland, we found out that activities can be seasonal or year-round. And in Highland, it's a bit of an inverse relationship between the season. You would think people would be active and when they aren't. In the summer months, when the weather's better and the daylight's better, many of the volunteers and people that support the activities we engage people with are very busy with the tourist season, and actually community activities tend to be in some parts of Highland more easily accessible in the winter months out of season. So there's a variety of prescription pathways that we've established. The first one are what we call direct referral pathways. These are the targeted ones. An example of this would be Branching Out programme, which is a mental health programme that people get referred to through their community mental health practitioner. It's a very formal programme. It's 12 weeks long. It has limit on numbers. And at any one time in Highland, we've probably got 2 or 3 branching out programmes happening at one time. It's highly effective, it's well evaluated, but it doesn't reach very many people because it's very hard to train the people to run these programmes and to sustain the work. Sorry, I've just hit the wrong button there. We then have supported self-referral, and this is working with our community link workers. We now have 28 community...
It hasn't appeared yet. Sorry to interrupt.
Sorry.
Don't worry about hitting wrong buttons. It's something everybody does.
So I'll keep talking while I'm getting it up again.
Please do.
The community link workers, there's 28 of them across Highland GP. There's 28 Highland GP practices that have a community link worker in post, and they are run by Change Mental Health, who are a charity here in Highland. Current slide, there we go. So that was the direct one. Can you see that now?
That's good. That's perfect.
Yeah, that's great. So while the course has been running, we've been able to engage with those community link workers. They're very well versed in, we have a directory of what green health activities are out there, and they're very well versed in using our materials. Obviously, there's more GP practices than we have link workers in Highlands. So we have 65 GP practices, only 28 of them have a link worker, and many of those are part-time. But we've been working with them for the last couple of years, and it's helping to engage people in the outdoors. We've also been working with the Active Health Project. So this is Jodie and Lisa, who are pictured here in the middle. They are run by a Velocity Cafe, and they run a similar link work service around physical activity and make person-based activity plans with individuals via the phone or online. In all these services, what happens is there's a person-centered conversation, and somebody makes a self-referral. So the individual accepts that they would be able to do this activity and refers on to it, and they're given the support to engage with that. So that model reaches more people and is relatively good impact and is being evaluated. The problem is that we don't have link workers everywhere. So where the rural areas are, we've got self-referral, and that is where we've got the website with the fleet of tools and resources and the directory of things for people to engage with there. So hopefully that gives you a picture of the different referral pathways and the types of work that we've been doing. What we discovered was that there are some commonalities across the different pilot areas we worked with, and we've developed a toolkit for green prescriptions. And in that toolkit, there's a sort of a process to work towards. We discovered that before, on this process, number 5 is the green prescription. And you can see there's 4 major steps to get to before you even get to the point of referring people in. And that's around exploring local health needs, identify the stakeholders, what are the driver barriers in those areas, and what can we do to build capacity. So a lot of the work that we did in our areas was around training service providers, helping them with funding activities, motivational interviewing of community link workers, a lot of promotion work and running events so that people could meet the service providers, clinicians in particular, and they're more motivated to want to refer. So there's been some challenges along the way, and some of those have included service continuity. It's very vulnerable in rural areas due to the low volunteer turnover and the short-term nature of funding. The buy-in from the healthcare staff is variable and influenced by other competing priorities. The language and process we use can over-medicalise and put off participants and providers. Measuring impact has been very hard, particularly because we're relying on third-party voluntary organisations, and it's a burden for them to gather some of this information that we may require. And related to that, GDPR compliance and data sharing agreements is a bit of a nightmare because we're working between NHS and what is often very small individual third sector organisations. Support and coordination is essential to continued uptake, but it's spread too thin. So as I said at the start, I wasn't able to work in all the community planning partnership areas as just one officer. And then we were sort of directed away when COVID hit. However, we're hoping with the use of the tools and everything going forward that the process will be more streamlined. There's great work going on there, but we often don't know about it. So, and this sort of leads me on to why got sort of nature, climate, health title to this presentation today. In the pilot areas where I've worked today, I've had really good relationships with the community partnerships and been able to feedback quite regularly what's going on in those areas. And I guess what we have an aspiration for is that that we can work with the other community partnerships, and there may already be going, every community partnership is very different, and you've all got your thematic subgroups and networks that meet. So there may already be discussions around this going on in Sutherland feeding into the community partnership, but we know that there are some places in Highland where there's a lot of great work going on in the ground, but it's not really understood at the community partnership level what's happening and why. So over the course of our pilot projects, the other thing we really discovered was that discussions about health and nature couldn't really take place alone. It often led to discussions about biodiversity, about climate impacts. And so I shared yesterday, and apologies for the late sharing of the document because I just got back from leave, but we teamed up with Highland Adapts, who's They're based in the Highland Council, and they're basically working across Highland, looking at how we respond to the changing climate through climate change, as community resilience is one of the real key benefits of green health initiatives. And we've also worked with the Highland Environment Forum. The Highland Environment Forum are a subgroup of the Community Planning Partnership, and they have a network of those with an interest in environmental issues. And together we've produced this guidance called Nature, Climate and Health. And in it, we're saying that community partnerships can play a vital role in establishing and supporting green networks where local action on nature, climate and health are discussed collaboratively in an environment of shared learning and accountability. So one of my, I guess, asks of the partnership today is really, you know, are these things being discussed in Highland, in Sutherland? And could we maybe pick up the conversation again and include green health into those discussions? We have availability of staff support for another year through the Green Health Partnership. And it would be really nice to use some of these tools that we've developed and integrate them into some of the work that's going on in Sutherland out there. So that concludes my presentation. Apologies, I've now lost you on my screen. I'm having a bit of a tech issue.
Not to
Bear
worry,
with me while I get rid of that. Yeah.
We can carry on in sound. I
Thank
listen to a
you.
lot of radio, so question is neither here nor there. I got your presentation, so that's excellent. Thank you very much indeed. And it's really food for thought, a great deal in there, which we should perhaps be addressing. One thing that always strikes me, the first question I always have for everything is funding. Funding doesn't seem to be secure, and the way the kind of public funds are, is it a major worry for you at the moment, or is it something that you'll just address as we go along?
We are looking at it centrally as a partnership. One of the first priorities for us at the moment is to look at how we might continue to fund that small grant fund. We usually launch it in the springtime. So we are looking for centralised funding now that the support nationally has gone. But one of the strengths we found of the pilot work that we did was it was actually much easier to tap into funding by working through the local networks and looking at more locality-based funding. And also partnering with our third sector colleagues opened up more avenues for funding to support this work. Hopefully that makes sense.
Ailsa, sorry, you're still sharing your screen. I tried to take control to close it down, but
I know I can't seem to find out how to. You'll see me going through all these buttons.
Hi, Ailsa, see if you see the Teams sign with the 9+. If you click that, you should get your back screen back, and then click leave. Aye.
Stop sharing. There we go.
Yeah,
thank you.
Benefit of teamwork. Teams is an education in itself. Okay, thank you very much again for the answer, Ailsa. And again, it's the standard thing of what's in it for me, and I'm glad you made the invitation to communicate about what we can do in Sutherland, how Sutherland can play a part in this initiative. I think there is already work going down, and David will confirm. Perhaps Anna Patfield will confirm also that there's a lot of work around the Kyle of Sutherland. And again, it's my ignorance that doesn't let me know what else is happening elsewhere. But I'm sure High Life Highland are taking this forward in their corners as well. So anybody wants to jump in now with any questions or comments are very welcome. David?
As Jim said, hi Ailsa. As Jim said, there's quite a bit of work happening with us at the Kyle of Sutherland Development Trust, working with High Life Highland and working with our local Woodland Trust and doing a lot of stuff. Fiona's involved in it as well. And I did, when I saw the presentation come through this week, I spoke to my colleague Beth Simcoe, and I think it would be really worthwhile setting up a chat between you to show what we're doing and to see if there is any way of other people learning from us and doing other things or spreading things wider. But I think that we have certainly accepted and made the link between nature and well-being and community well-being, and we're trying to help as best we can through all generations, from children right the way up, to try and ensure that people can access the world-class natural assets that we have that many people take for granted or don't understand that, you know, what they can do with them. So yeah, what I'll do is Fiona will broker a meeting between yourself and Beth at some point. You can maybe come up and have a wee visit, and we'll take you in the polytunnel and stuff, and then see where we go. But I think there's a lot of good work being trialed, and then we can learn what's worked, what's not worked, and see where we can spread it, and use the resource that you have the next year to try and see what we can do in Sutherland.
And certainly the aspect, the thread of mental health and emotional well-being is something that I'm not on top of, so I could probably do with more work myself on that angle and to improve my own understanding of what's going on. I think Anna from Planet Sutherland and then Stuart. Anna, were you intending to come forward?
Yeah, thanks, Jim. Yeah, hi, Anna Patfield from Planet Sutherland, Climate Active group here. There's a couple of things that we're doing. One is we try to run regular climate cafes, which essentially address the anxiety that folks have with the climate crisis. But the other thing that we're actually doing right now is, as part of the Highlands and Islands Climate Festival that's running through September, is trying to pull together a book club group over a book called Act of Hope, which is about accelerating personal resilience and trying to support that. David, we should perhaps have a talk about that as well. I hadn't really kind of clocked until this talk just now. I hadn't really kind of pulled that circle together. So we've already had one meeting, so and are pulling together another group to work through that as well. So it would be good to have a chat with you about that, Lisa. Thanks.
Okay, thank you, Anna. It's a good offer. Stuart, you're wanting to come in? I think you're muted. Are you muted, Stuart?
Sorry, somebody had to do it first in this meeting, so it was me. Thanks, Ailsa, for that. And David, I don't know whether that your signposting to various names what to Ailsa incorporated it, but Ailsa did mention that I'm familiar with the thematic subgroups that we have, but we do have Sutherland Cares subgroup, which obviously incorporates mental health and things like that within that. So I know David and Kyla Sutherland initiatives he's got running there, but this could obviously be spread a little bit wider as well within that subgroup. So it's just making sure that Ailsa, that the thematic subgroup of Sutherland Cares also touches base with you.
Thanks, Stuart. Fiona?
Yeah, it was just to say that I'll drop you a message, Ailsa, because I do have a few ideas maybe of things that are going across Sutherland that might be of interest to you, and then I'll put you in touch with Beth at the Trust and Kyle Sutherland too.
Okay, thanks, Fiona. It's good. Marianne?
Hi, Ailsa. Thanks very much. That was really interesting. It's just, I don't know which things you are in touch with or not, but there's quite a few things going on in Assynt. There's the growth project up at the community garden, the leisure centre, obviously High Life Highland and the youth development officer do a fair bit in the outdoors. And of course, the High Life Highland Ranger Service does a lot with all stages, you know, right from the preschool right up to the people who attend Assynt Community Care. So I'd be happy to be in touch anytime. And there's also a community wellbeing group in Assynt as well. Thank you.
Thank you very much, Marianne, for that. Thanks for that. Another good offer.
I think this is one of the benefits of speaking to the groups is that when we're central, I know some of these initiatives and the rangers sit on the partnership, but it's when you go into the localities, you discover all this other action that's on underway that you can't capture at a central basis. So you need that local knowledge. So thanks for that.
Yeah, I suppose you'll have a whole mapping exercise to do to sort of try and pull things together, which should be excellent to see in due course once you actually have make all the connections. Any other comments or questions? Sorry, Angela.
Thank you. Sorry, just quickly turning my camera on there. Yeah, I was just saying invitation there, Ailsa, to the Sutherland Resilience Group. So you've got all these sort of anchor organisations, community development trusts, a number of which we've just been talking about, but others also that aren't here today that are also perhaps doing projects linked to your activity. So by all means, you're welcome to come along to that in the future and hit everybody in one go.
That's a very good offer. Yes, and actually, there's so much happening that sometimes I can't absorb all that's there, and it's good to have other members of the team coming forward and filling in the gaps in my knowledge. So thank you, Angela. And anything else we can touch on with Ailsa? In that case, Ailsa, thank you very, very much indeed for your attendance and your presentation and answering questions. You're quite at liberty to depart should you so wish, but if you wish to carry on with the rest of the meeting, you're also equally welcome. So thank you very much for your attendance and thank you for all your help.
Right, thank you for your time, everybody, and I'll slip away now, but enjoy your meeting.
I'll see you later. Cheers. Next item is the Southern Transport Project, which is galloping along, led by Councillor Richard Gale. Richard's not here today, but I think introduction could be picked up with either Scott or Fiona as required.
Yeah, I'm covering this today, Jim. So
thanks, Scott.
I've got a written update here from Richard that I'll cover. So firstly, for those that don't know me, Scott MacDonald, part of the SCP project support team, working at Kyle Sound Development Trust. So I've written an update, as I say, from Richard. So firstly, he sends his apologies. Something comes up last minute that he couldn't make it today. This is a really important subject matter for everybody in Sutherland, obviously, and a really exciting project that Richard's got underway. So I'll just read what Richard's written here. The transport subgroup is still meeting, but events have overtaken it. Early this year, since a decision was taken to take a more direct approach to the transport problems that we knew existed, things have progressed quite a bit. We, my council colleagues and I, formed a constituted group to apply for some funding to have a survey carried out across all 17 community council areas in Sutherland to ascertain what transport already exists, what the communities felt that they needed, and what the transport aspirations of the communities were. This survey was carried out by the SCP project support team through Kyle Sound Development Trust. Shortly after this survey was commissioned, I became aware that Focus North were carrying out a similar survey using urban foresight, looking at the transport across the north coast, including Caithness. I met with Peter Facenda of Focus North, and after some discussion, it was clear that we had very similar aims, albeit the Focus North interest was purely on the north coast. That being the case, it was agreed that if we put some funding into the survey, Urban Foresight would extend their survey to the whole county. I felt that this would fit well with Kyle Sound Development Trust, with what Kyle Sound Development Trust were doing for us, and I introduced the two parties and a way forward was agreed. The surveys have now been carried out by Honorine from Urban Foresight and by the SCP project support team. So for our side of things, from the SCP project support team, we put out a consultation document back at the end of June to all the community council and development organisations within Sutherland. And basically this covered, I'll just read the first paragraph from that, a new community organisation constituted as the Sutherland Transport Group has been formed to look at increasing and improving accessible and sustainable transport options available to all the residents and communities of Sutherland, including those with mobility issues. The group will work with existing providers to ensure there is no duplication or displacement of existing successful services. So the initial aims of that group were to investigate the provision of existing transport services across Sutherland, ascertain the need and demand for transport services, public, private and third sector, work with communities to develop a plan addressing the needs across all of Sutherland, including patient transport, school transport, after-school requirements and employment, work with all stakeholders to promote the transport services already in existence and to create a comprehensive transport plan that encompasses all existing providers that express an interest in partnership working. So in that initial document that we sent out, we'd asked everybody to respond to respect to 3 questions. So the questions that we asked were, what transport services are currently available in your community? What are the gaps in service that affect your community? And what services do you need to allow people to live and work without disadvantage in your community? This was followed up with a couple of evening consultations that everybody was invited to. So on the 3rd and 4th of July, we had Teams meetings in the evening time that everybody could tune into, and that was relatively well attended. We were aware that we'd put out this sort of bang in the middle of the summer season, so we extended the end date for response to come in till the 25th of August. But what I would say is that any community councils or development organisations that have yet to respond would more than welcome further responses to come in to add to that, please. So from that, the 3 questions we put out to the 17 community councils. We've got 8 responses back. We put it out to 15 development trusts and organisations, and from that we got 6 responses back. We also, the survey had been forwarded on to a few individuals, so we got 4 responses from individuals in the area as well. So a relatively good response so far, but as I say, we'd still welcome further responses. The common themes that came through the questions that we posed will come as no surprise. It was medical appointments, getting to and from, people feeling isolated, the after-school activities, and kids in local areas not being able to get to their after-school activities. Getting to and from work was really important for people. Connecting services, so buses that actually connect to another bus that will get you from A to B is really important. There seems to be real issues with that as well. Ability to socialise between villages, be able to go and visit friends in nearby villages is an issue. And also one thing which I thought was quite pertinent that's been flagged up was young and old people, as likewise everywhere else in Scotland, have their bus passes now, but there's a real inability to use that because of lack of provision of buses that are out there. And yeah, so that was pretty much it. And then the information that we've collected so far, we've shared that with Honorine, who's obviously acting on behalf of Urban Foresight and that part of the project. So at this stage, I'll invite Honorine Ndunga from Urban Foresight to present her side of things. Thanks.
Okay,
Thank you.
Honorine, the floor is yours, and a warm welcome to our meeting.
Thank you. So I'm Honorine Ndunga. I'm a senior consultant at Urban Foresight, and I specialize in sustainable and zero emission transport. So, and I'm based in Dundee just now. So I will share my presentation with you, but it will really mirror what Scott just said, really. So like Scott said in the introduction, we were brought into this project by Focus North. So our presentation covers the whole of Sutherland and Caithness, and the study we done as well for the two areas. So to tell you a bit more about where we are just now, so the transport study, the first phase, before we talk about the phase 2, but I'll go on this after, is that we first started by trying to find what would be the vision for the transport in Sutherland and Caithness by 2030, based on stakeholder engagement, but also policy review and data collection, and looking at what has been done elsewhere in Europe, in the world, and what seems to have been working in areas that are similar to Sutherland, to get inspiration. And then once we had that vision done and agreed, try to have a transport modeling of what that could look like. So for now, we've been building what we call the business as usual scenario, which will be really the base of we will use to then project more ambitious scenarios if we do the kind of project we aim to do to improve transport, and how the place of the private car and especially the driver part of transport can decrease as much as possible to have more public transport and active travel. And so yeah, right now we're really in the trying to build that ambitious vision and how we can meet it in a realistic and sustainable way. So I'll try not be too long, but I've tried to condense a lot of information into slides and lots of spreadsheet. But starting with the context and setting up the vision. So here you have the 3 challenges and opportunities we have identified here. So of course, a big presence of the private car, And especially when we look at driver and passenger rate, especially drivers, so like people using their car by themselves, which is not the most efficient, even for shorter journey, because just no choice. No choice, because sometimes even though there is a bus or a minibus, etc., the path to go there is not necessarily a nice path to cycle on, or it doesn't feel very safe, or it's not really accessible for people who have more mobility issues. And a bit like it was said before with Scott, a mismatch between the different transport offer. I can go to Inverness, but I cannot go back at night, for example. Or the bus and the train are not linked together, and the dial-a bus is only on this hour, but I would need it on this other hour. So a real lack of information also on how people actually travel, which is what we try to do to understand better through the survey. And in terms of opportunities, this area compared to even other area in Europe and even in France, where I'm from, has more quite good opportunities. So first of all, it's the will from people to actually do things, and that also transpires through the kind of Sutherland survey, with people being willing to become drivers and volunteer, etc. And also the strong will to have sustainable transport and even electric vehicle, which is not something across the UK we saw often. Often we saw people that were reluctant to that. Also, what was important here when we talk about shifting from the private car, we really insist on private car, because in some areas, the car may not be replaced by a bus, but it could be replaced by a car club, for example, or a van that can be shared within the community. So really trying to find something that makes sense, and not just put more buses if it's not needed, but at least just a good transport option that is not the private car. So what we then try to do is to kind of map what's the current context as well. So of course, as you should know already, but like the East Coast, that has the most transport provision, although that could also be problematic with the A9. We've seen that quite often in the survey, but in the West Coast, so that's where the road count was the lowest. But still, we can see that there are services here, because we tried to map all the point of interest. And even though there are quite a lot of bus lines that covers kind of the whole area, it's more in terms of the timings and frequency that people had issues with. So based on all this context, the vision we came up with was to have a unique, integrated, sustainable, reliable and affordable public transport network for the north of mainland Scotland. So unique because we felt like it would make the most sense trying to have everything into one place for people, make it as easy as possible for them to book a car, a bus pass, dial a bus, DRT, and ride a bike, for example. And for this, it has to be integrated. Sustainable, because there's still the potential of the wind farm in the region that could power all these vehicles, and also allows to have a more cost-effective approach, because we know that now you can make savings on this type of vehicle, and use technology to have something more reliable for people, and hopefully have something that is cost-effective enough so that it can remain affordable for local living here, and not just a good, nice, shiny transport for tourists coming here to use. So as I was saying before, in terms of the modeling, to kind of try to see what would happen if nothing was done, so then we can build on that. So we used studies that some of you on that call may have shared with us, gathered a lot of data and took the policies, and also we used the survey to tweak it, to come up with this share of modal split. So this is what you have today. So to do this, we used the survey to know what people said they were using. And we tweak it from the Highland model split and mileage with what people were saying they were doing and what would happen in 2030 if nothing was done. So just a small reduction of the driver side. But for example, we took into account the under 22 bus policy. And when compared to other countries where this has been done, it did have a big impact, but not necessarily in terms of people not owning a car, because it can still be either a reason for status or just very useful for picking up groceries, for example. So even though younger people will tend to take more on a bus, they don't necessarily drive less, if that makes sense. But it's something that can change when there's a change in ownership with car clubs, for example. So like I was talking about the survey, in terms of results from the questionnaire we had, so in total we had 354 answers, mostly from Thurso, but still 30% of it was from and around the Sutherland area. So here you have it. Most of the people were from the IV27 area. Sometimes we just didn't have the name, and Dornoch most of the time. So still quite a good spread all around. And in terms of the demographic, so we kept it here as the 354 people because it was quite similar. Mostly retired people, so it's just slightly higher than the Highland average. Highland is 60%. Most of them were working in healthcare, and 24% had a long-term condition or had a disability, which is, or again, just slightly higher than the Highland average. And in terms of the age, again, that's kind of mirroring it, but a little bit more older than Highland average. So if we compare, it's quite representative. It's just that in this one, we don't have any kids or children because they're under 18, and therefore it's not as easy to get their answers. And in terms of vehicle in their household as well, a little bit more than the Highland average. People owned 2 or 1 car, sorry. In terms of how much they're traveling, so they're traveling more than the Scottish average because it's around 7,500 miles. We were at 7,900, almost 8,000, because many people are just go to work in Inverness, for example. And of course, we can see it here, strong presence of the private car, 82% taking it. But the most striking data, and I think it can also reflect what was said with during the ILSA presentation, is that there's not much walk, but also not many people are taking the bus. Only 3% take daily. And you have here the reason why they're not taking it, not frequent and not reliable being the most ones. And in terms of how this affect their life and their opportunities, leisure was the one that came back the most. And that is something we had quite a lot, even in the written answers that I'm going to present soon. Having access to being able to, like I said, go to Inverness, but be there at night, be able to have a drink and not have to come back at 5 p.m. So yeah, be able to socialize and have access to health and access to work. So what was, I think, no surprise for you. And so here you have some testimonies of people, what they said they would like to have. And some of their answers were possibly not realistic. And I don't think we're going to see many more train stations being built in the area. But overall, quite reasonable and fair, just more buses and more reliable. And like I was saying before, very open to more integrated transport and sustainable transport. So we have summarized their written answers. So there's a lot. So try to summarize it in 6 points. because we asked them what, if you had to imagine your perfect network in 2030, what would it be? So again, first one was more frequency, more reliability. Accessibility also came back quite often. We've seen it, 24% is not small numbers, not small proportion. More DRT and sustainable travel, and also active travel infrastructure. So I had in other engagement that having a bike may not be a good solution in some part of Sutherland, because it's just like, we're not going to bike there, it's just too long, etc. But just sometimes the path between the home and the bus stop could be done by a bike, and not just having a bike scheme like you would have in a very urbanized city. And then we asked them if they had anything to say. So yeah, here in these two slides, I've only extracted people from the Sutherland area. So more services to Tain, Golspie and Dornoch. More reliable services to go to hospital appointment. Also, yeah, service being cut. That was kind of a worry. Upgraded rail infrastructure, that's what I was saying, may not be as possible. I don't know if ScotRail would be keen to do that, but we never know. More transport for young people after school activities, smaller buses, also, yeah, more services in evening, not only for leisure, but also for people working in hospitality to be able to go and come back to work, and more DRT to isolated areas. So in terms of what's next, now we have a good understanding of the context, what are the problems, what are people willing to do, what they would like to see, and what may be possible or not. So we had some meetings with also companies to see if having technology here to optimize that transport, making it more reliable and frequent was possible. And not just a good idea. And it seems to be possible. There are companies who are specialized in providing software in very rural area, and not operating anything, but just making sure that we have that kind of like integrated transport. So then this is going to be a platform that is made by and owned by the SCP, for example. That's still something we need to think about. Going towards shared and community-based vehicle and transport, like I was saying, having a double-decker bus on the North Coast 500 doesn't make sense, but having more minibuses, more shared cars, and also shared vans would make more sense, and hoping to have this transport powered by renewables. So we're also trying to engage shortly with the local energy provider to see, again, is it possible? Is there enough power here to have electric vehicles and power them, and how much that would cost as well? And finally, we will travel very soon. I said on the 3rd, but it's actually on the 4th, to Golspie and Thurso, where we're going to see some of you, and hopefully try to tie that up. The end of the project should be by the 2nd week of November. So this is where we are, and happy to answer any question you'd have.
Well, thank you very much, Honorine. Just to set a wider context to this, I can remember many years ago a report coming out about transport in Sutherland, and it was just a report, and a report that gathered dust. And I think in the last 12 months, a report has come out from Inverness, from various organisations about transport in the Highlands. 145 pages of 10 point, which is a very difficult read, and which again is gathering dust. So Richard Gale is to be commended entirely for picking up this and running with it. So we're actually seeing some actions attached to all the words that have been written down over a number of years. And I think the timescale is pressing. Honorine mentioned November. I think there has to be grant applications in for January, and having some kind of system up and running for the spring, for the new financial year, and dealing mainly with access to health appointments, education, and then finally, as we get further into the project, we'll be looking at access to employment. So thank you very much, Honorine. Any questions for Honorine for a very comprehensive report and presentation? I particularly liked the term model split. I haven't seen that for many years, so it brings back memories of a time of a life that is gone. Any questions, any points? Well, we are full steam ahead then, and traveling forward. The only way is forward. Oh, Scott.
Yeah, just I've obviously got a further written update from Richard, Jim, just to follow on Honorine. So thanks very much, Honorine. That was really detailed and really helpful. Excellent piece of work pulling that all together, and it looks really impressive as well. I'll just read through the next update from Richard, just in summary. So the next phase of the project is to develop an integrated Sutherland transport plan with the intention of rolling out the first part of that plan in April of next year. I've applied for funding from the Community Regeneration Fund to build the plan, and we've engaged Urban Foresight to carry out this work on our behalf. The idea is to use the information gathered from the two surveys and to build a plan that looks at each community and create a transport strategy that will address the needs of each area and break down the barriers that we know exist. The idea being that we look at it in a staged fashion, with the first stage of the plan to be rolled out in April next year. This will address two main transport issues. First being transport to health clinics. Currently, there is no patient transport service. And for example, if someone in Scourie needs to go to an eye clinic, they have to rely on friends and family to get them there, as often, even if they have a car, they can't drive due to the type of treatment they're receiving. Also, as part of the initial rollout, we want to address the lack of transport that prevents children from all areas to participate in after-school activities without having to worry about how they will get home afterwards. We know that this is an issue at all of the high schools across the county, and as a result, children in remote and rural areas are excluded from after-school activities. The impact of this hampers their social development, their academic performance, and indeed their mental health. Moving on from stage one, over time, we also want to look at providing a reliable transport to work service, as in most cases, there is no public transport and what there is does not fit in with work patterns for people. The final stage of the plan is to look at building a scheduled transport network linking up all communities in the county, but we recognise that this is some way off. Finally, as a group, we need to decide on the best vehicle to take this project forward, and that could be as a charity, as a Scottish Charitable Incorporated Organisation, known as a SCIO, or as a community interest company, also known as a KIC, or a company with charitable status. It will be a not-for-profit organisation and should be community-led. The decision on that will have to come soon, as it is a necessary part of applying for funding going forward. And Richard's hoping to discuss this with ourselves at our meeting next week. And that's it, thanks.
Okay, thank you very much, Scott. Any further questions? Okay, thank you very much. Well, Honorine, thank you very much for attending and your presentation. We look forward to seeing much more of you. And again, if you have other pressing business, please feel free to move on and carry on the rest of your day.
No worries. Thank you very much.
Okay, cheers, Anne. We move out now on to subgroup updates, and the first one on the list I have is transport, which I think we have thoroughly covered, so I wouldn't like to dwell on that. Fuel poverty, I've circulated my update from that particular subgroup meeting. I'd only highlight that the thanks that we are due to David and to Di Alexander for attending the Fuel Poverty Advisory Panel. And also we are attending the Rural Energy Consumer Working Group, which has a couple of ministers and a cabinet secretary in attendance. We've attended two of these and tried to make our points known. And we are looking at the third one coming up shortly, third and final one coming up shortly. So we'll just see where that takes us. But apart from that, we're probably due great thanks to all the support that comes around from Home Energy Scotland and Ali Energy for the input that they make to keep households really afloat in a difficult time. If I could just prevail upon you for a minute, David Bell, Professor David Bell, did a report on the UK energy system, and I have to kind of give you Di Alexander's summary of what he saw, and he mentions the unfathomable complexity of the UK's energy market system. And another quote, the sheer enormity of the legalized robbery and the ensuing injustice makes me despair as to what on earth mere southern mortals can realistically try to do to restore some kind of sanity and equity to this well and truly broken energy market system. So I think that's a fair summary of where we are at the moment. And as I've been in contact myself with the local complaints officer with SSE online, and finished up remarking that if you swim with sharks, you can only expect to get eaten by sharks. And I think that's where we find ourselves at the moment. So I'm not quite sure, unless there's any great national initiative coming forward again, just where we go with the winter approaching. David?
Yeah, I just want to highlight the fact that Jim's chaired this group for a long time, and the Sutherland Community Partnership Fuel Poverty Group has got real traction, and one of the reasons that we were invited to the Scottish Fuel Advisory Panel was because of the section in the Changeworks report about Sutherland, and the reason there was a section about Sutherland was because of the SCP Fuel Poverty Group. So we need to congratulate the hard work that's gone on in that group for a while, and I think what we've been able to do is, instead of now of people talking about the problems of energy in the islands, they are recognising that there are mainland areas that have the same problems, and Sutherland is getting recognition there for facing similar issues. So that we should be really proud of that from an SCP perspective, and we'll continue to do the hard work. In fact, I heard Di on the wireless this morning again talking about the inequalities of energy pricing and making the case for social tariffs and things like that. So we'll continue to do that. Sutherland has been recognised as an area that needs support, and we're actually speaking to very, very senior ministers at the moment about that. So hopefully we might be able to see some change. But as we know, the energy market isn't a devolved issue, so it's a case of us informing people who then have to inform people who then have to make a change, and it's really challenging, but I think we're doing a pretty good job of doing it. And Jim, you're part of that, so well done.
I'm merely merely the eye candy at the front of an organisation which carries things forward. And I think I would emphasise the point that you continuously make, that our depopulation is fundamentally arises from things like fuel poverty and indeed food poverty. And I think we have to keep rattling, and you're doing that very well, rattling on that particular aspect and making sure that that hits home, that the two are inexorably tied together. Next thing I have is food poverty, and again, we're just really similar terms to fuel poverty. I think we're well supported by groups like CFINE. I think the Argyle Game Bolognese initiative has been tremendous. I still haven't tasted it myself, but I look forward to doing so. I think that's putting stuff on the plate is a prime requirement of where we're going. And I think we still have a viable context and contact with Westminster on there, even though it's for under 25s mainly. That's still an important age group that we have to hit. And of course, we still have some residual council funding tucked away just for that rainy day, should things not particularly improve over the winter months. So I'm very grateful to all who attend these meetings, and I think what comes across is that demand is steady for the support, and we're grateful to local businesses who actually chip in their surplus into the pot as well to help things move forward. Demand is steady, and I think resources are falling away. So I think we enter quite a difficult winter, and hopefully September's mild spell will continue for a while yet. Okay, if people are content with that, and any questions I can answer on either fuel and food. Okay. Marianne, can you ready to come in a bit on homes? Again, another valuable contribution to retaining our population.
Okay, thank you. The Homes and Infrastructure group is the newest of the thematic subgroups, but I think we've covered quite a lot of ground since we got going due to the knowledge within the group, and we've had great support with presentations from such as the Scottish Land Fund, Forestry Land Scotland and BEST, also Communities Housing Trust, HIE and the Highland Council itself. So we've got off to a very good, well, I think we're past our start now. The last update we had from the subgroup was just before our learning visit to Gairloch, which was a really, really great day, benefited in lots of ways from that. It was facilitated by the Communities Housing Trust, and on the way to Gairloch, we looked in on some of their established developments. Nicola and Sarah of Communities Housing Trust provided information on the history of the projects at Shieldaig, Lochcarron, Torridon, and the progress. These developments demonstrate differentiation of design and of tenure, and it's exactly the sort of scope and range we need for Sutherland communities to increase their capacity and to thrive. At Gairloch, we were welcomed and shown around the Gale Centre, the museum, and the various housing that's been built there, also the businesses. So it was a really holistic model for us to think about, and I would recommend anyone who hasn't been there to go and just have a look at it. It's a really, really positive experience and definitely a learning experience. It was just sort of materialised lots of things that we've discussed in the group and the aspirations of the group. So moving forward, we're so fortunate to have time with the community members there as well, who've been with the development since it began, and they're so willing to share their knowledge, their experience and their positivity, which is, you can just feel that when you're with them, just how proud they are and how much has been achieved there. Sincere thanks to the Communities Housing Trust, the Gale Centre, Fiona MacDonald, and it was a very meaningful and enjoyable learning visit, and of course to Go Golspie for getting us there and back safely. The visit was followed up by Communities Housing Trust presentation to the whole subgroup, which reinforced key elements of their developments and gave an opportunity for us to discuss it as a group. The subgroups agreed that Sutherland needs urgent action on homes and infrastructure, and that we're really ready to take this forward in the SCP. The subgroup decided to form a steering group. Some members of the subgroup volunteered, other people have been invited into that. We've got representation in the group from Communities Housing Trust, Kyle of Sutherland Development Trust, Ascent Development Trust, Highland Council Housing and Development, Sutherland Full Poverty Action and HIE. The first meeting of the steering group was held this week. It was a really constructive, positive discussion of what's currently happening and what needs to be done. It was agreed, and other people who are in the group can keep me right on this, it was agreed that tackling depopulation has to be our overarching priority of the group. Nobody's going to argue with that, I don't think. Partners should be brought together to work collaboratively and, where possible, share resources and progress community-led developments. SCP Focus North and Northwest 2045 should be brought together to focus on repopulation. And we'll bring policymakers, funders and planners from the Scottish Government and Highland Council to Sutherland, along with the Communities Housing Trust, community development groups at a summit on rural population later this year. It's very much a summary. I feel doesn't cover everything we've been doing, but I'm really happy for anyone else who's on that subgroup to contribute or correct anything I've said. Thank you.
Many thanks, Marianne. You've well and truly hit the ground running indeed. Any questions or comments to ask of Marianne or to supplement what she's saying? No? Okay. But it's a very successful trip to view what's happening with the Communities Housing Trust. And I think I really have to commend what Ronnie McRae and his team are doing. They have really sort of taken a grip of a whole initiative and carried it forward. Christine?
Yeah, just to say, as a wee bit perhaps of an update from Scowrie, we've now got our application lodged with Highland Council for the actual building of obviously 9 homes in Scourie. So obviously fingers crossed that doesn't become too onerous a problem for us with regard to the various time frames and the money involved in trying to pull the project together. So it's some good news for us anyway. At least it's lodged at the moment for as a full planning application it's in, so that we hope to hear some response coming back from that application perhaps in the next week or so. Anyway, fingers crossed that things go ahead.
That's excellent to know. Very well done indeed. And I'll have a look at that planning application on the website to see what's involved. I would hope that there'll be no obstacles coming forward from any planning committee for an initiative as valuable as this. So well done. Excellent.
Okay, thanks.
Any other comments on homes and housing? That's a bit of good news to finish up on then with that topic. On to emotional well-being and Sutherland Cares. Leslie-Ann, anything that you wish to kind of bring to the attention of the meeting?
Hi, sorry, we haven't actually hit the ground running, and that's my fault. Sorry, I've just been far too busy. We've sent out some invitations for people who were in the group previously, and we're hoping to meet in November and to try to restructure the group and take it forward from there. I don't know if Fiona's got anything to add. Sorry, folks.
No, I quite understand. It's a very steep learning curve to get on top of all these issues. Indeed, yeah. You think?
Yeah, just to say to the group that if there is anybody who hasn't received an invite to the November meeting, to just drop me a message and let me know. Or if you can think of anybody who might be interested in attending, it's open to anybody who's got an interest in mental health and well-being in Sutherland, third sector, or volunteers, or just let me know.
Okay. Yeah, that'll be a good next step. We can proceed with that. We can make progress with that. Looking on then, North Forum. Heather, if you're in attendance, would you wish to kind of bring us up to date on that, please?
I don't think Heather is here.
Okay.
She has sent in a written update,
Is it something
which
that
I will circulate. Just to say, the last meeting was in August. Natalie was there from Ali Energy, who gave a little bit of a talk about her work with Ali Energy, and Isabel from Alzheimer's Scotland was there talking about the work she does for with the dementia cafes, etc. In Sutherland. And the next meeting is November 30th at 4:30.
Okay, thanks, Fiona. Central Forum, South and Central Forum falls with me, and I think with the change of the community council elections coming forward, we decided to sort of leave the last meeting alone and look to pick up with new community councils in December and pick up initiatives there. So it's again, it's just in a takeover mode. The attendees so far have been few, regular, and again, as I keep emphasising, encouragingly cynical. So it's we'd hope to sort of maintain these aspects as we move forward into December with a new batch of community councils. And again, the only other thing I would comment about the upgrades so far is we are short of a chair of the employability. And we'll have to work on that as a priority coming forward into as before the next meeting to see if we can actually get revive that particular aspect. Okay, if there's any further points or questions, oh, sorry, Fiona, just saw your hand there. Sorry.
Yeah. Hello, I'm Fiona Webster, so I'm the Client Services Coordinator for the Herring Council Employability Team. So I cover Caithness and Sutherland, but I think it's normally Heather MacDonald who would cover the employability for the Sutherland area. So I'm just jumping in today, but just when you said that you hadn't got anybody from employability, I can give you a quick update of where we are.
That'd be perfect. That'd be lovely.
Yeah.
Thank you very much.
Yeah, I haven't got anything organised. I wasn't expecting to jump in. I thought Heather would be here. A couple of things we've been working on. issues in Caithness and Sutherland has been around childcare and transport. I'm not going to go too much into the transport because I think you've pretty much covered it today. One of the things that we were trying to work on was being able to get students from Melnair from North West Sutherland into Thurso College. Apparently, I had conversations with our high school, and they were having issues with some of their 5th and 6th years who live in Melnaith and Tongue. And because it's a community bus transport for Tongue, they can only get public transport up as far as Betty Hill. So they were having to pay £10 a day to be able to attend college, which is, well, they were saying £60 a week to be able to attend college because their concession at Young Scott card doesn't cover them for the community bus. So, and they had tried for the bursary at the college, but seemingly it's mean tested. So if their parents can afford to pay for their travel, they have to pay for that, which does seem a bit unfair considering that everybody under 22 should be able to access free transport. So I'm hoping that's one of the things that will be covered in the Focus North survey. All the college students were encouraged to respond to the survey. So hopefully that will be highlighted, you know, in that. The other thing I've been quite involved in is the lack of childminders in the area in both Caithness and Sutherland. So I have been working with the SCMA, the Scottish Childminding Association, along with some of the other partners who've been driving a recruitment campaign to recruit 100 new childminders in Scotland. And they have prioritised some target areas in Highland, being Caithness and Sutherland and Skye. The employability team, along with the SDMA, have match funded. We've offered 8 fully funded places whereby we're trying to encourage 8 new childminding businesses to start up. So, and that will be fully funded. So that covers everything from induction, registration, training, what have you, everything needs to be to get their business up and running. We did have myself and Caroline Green from the ELC department and the Highland Council have really pushed hard to try and drive this recruitment campaign across Caithness and Sutherland. And we had a total of 43 inquiries across Caithness and Sutherland, which was tremendous. However, only 5 of those have taken it to registration, taking it to the next step. So we have been trying with the SMA to go back and find out what was the barriers that were there that stopped the rest of those people from taking it to the next step. And it seems to be, for obvious reasons, financial insecurity, because we're a sparsely populated area. Is there, you know, it's quite a big step for somebody to give up full-time employment to go into childminding, but there's no guarantees of how much your income is going to be over the year. Also, there was the barriers for paperwork, the amount of paperwork that was involved in setting up a childminding business and ongoing paperwork. Because your time is spent with the children, you don't get paid for the time spent doing your paperwork. But I believe there's something in the pipeline that is going to change that. There is also, sorry, I've lost my train of thought there. Yeah, there are other things going on in the background that we've asked them to go back and do another survey to find out what it is, what the barriers are. I'm trying to think, there was also, we've had talks with the Scottish Government, with the Care Inspectorate, myself, and a couple of other partners, along with the Care Inspectorate and Scottish Government. A lot of the legislation and regulations around childminders does not suit the Highland area. So we're looking to see how we can maybe possibly run a pilot whereby they can see what changes need to be made to make it a viable proposition. One of the easiest things would be to offer a salaried childminder where they had a guaranteed income you know, and that's maybe where we need to bring in the wind farm funding or, you know, something like that. But there are various conversations going on about how we can try and overcome some of the barriers that we've got at the minute. I am aware that the Scottish Government is saying that they're hoping to recruit 1,000 new childminders in Scotland before 26, 27. Well, all I can say is good luck with that, because we have been trying so hard, even in Caithness and Sutherland. They are doing test pilots in various areas with 6 other local authorities. 4 of them are in the Central Belt. And, you know, that has absolutely no reflection on the barriers that we have up here, the problems that we have up here. They are saying that they're going out to rural and island areas. The rural area, as far as I can gather, is in Fife, and the island is in Shetland. So, you know, it's not very helpful for us at all. So that's it's a slow process, but we are battling on, and we'll do as much as we can to try and make some headway. But so yeah, I think that's about it I've got at the moment.
Well, thank you very much there for stepping in, Fiona. Can, if we haven't got a chair sorted out next time around, can I invite you to attend again and keep us up to date on every effort in getting support for these students going from the North Coast into Thurso College. I think it's despairing when you face a £60 a week charge just to get to college. That is truly ridiculous. And I'm well aware of childminding problems. It's one of the kind of childcare is a major issue that we face in this county. I've asked Caroline Green what's coming forward from the Scottish Government, and I think we both agreed there's a lot of smoke and mirrors, but certainly for the Highland area, we're not seeing the support that we would anticipate or hope for coming forward. So I share your grief and pain on that one. That is just something that.
Well, yes, and especially with the poverty, you know, the child plan that's coming through, you know, we need to try and get childminders up to be able to get people back into work, to help parents get back into work. So unless we get the childminding issues sorted out and the transport issues, you know, we're always going to have that problem where we struggle to get our clients back into employment, you know. The other thing I was going to mention I forgot about was when we did the recruitment campaign, we had a big campaign come out through our corp comms in the Highland Council, and we put it through to all the schools, all the nurseries, to try and push out to parents. Some of the schools were better than others. Some schools didn't put it out at all. Whether it was a case of resources, you know, I don't actually know, but anything we can do to try and promote that would be great.
Okay, thank you. And just to recap what you said there, just for more information, of the 6 pilot areas, we have most are in Central Belt, 1 in Fife and 1 in Shetland. Did I pick that up right?
Yes.
Yeah.
Where the 1 in Fife and 1 in Shetland is not actually started yet, but that's going to be the next sort of adopted area that they're looking to do a pilot in.
We shall follow the case with interest. Marianne, sorry, I've kept you waiting. My apologies.
No bother. It was just to say to Fiona, I completely agree with you about all these issues. It would be good to link up after this, because I've been working with Northwest 2045 and the Kinlochbervie and Melvick areas in particular to do with the childminding issues. And as you say, the models don't fit for our remote and rural areas. There is a consideration there of creating a salaried post for a childminder, which would make it a more viable option for somebody and a career for them. That's been looked into in collaboration with Highland Council. Also with CALA, they're looking at a model of having childminders who could work in a setting in the morning and childmind in their own home in the afternoon, because up until now, childminding is in your own home, and it was a kind of inflexible model, but they're looking at perhaps something that would be more applicable to the communities that we're looking at. So it would be good to speak to you about all of that, because we're obviously on the same train of thought. Sure. What was the other thing? Yeah, about the childminding for relatives. At the moment, if you childmind for a relative, you can't claim the funding. which again doesn't work for our remote and rural. So representations have been made via Marie Todd to the Scottish Government to see if we could have something there, an amendment of some sort, so that would be changed, because the nature of our communities is that you would usually be looking after somebody who's related to you if you're a childminder. Also on the transport for the students, be good to link up on that, because we have managed to figure out a solution for one young person up in Tongue. So I'm hoping that we could maybe do that for the other people that you're mentioning there. Thank you.
Thank you very much.
That's good stuff, Marianne. Thank you very much indeed. And when Fiona mentioned the care inspectorate, I must admit, it's one of these things where my blood chills when I hear the term. They're very rigorous, and rigor has its place, but so is flexibility. And I think we really have to encourage some flexibility into their perspectives. The report came into the nursery in Dornoch, which I did not recognise. It was simply critical, and I've used it for 2 generations, and I just did not recognise that report. So I don't know where they come from in some places. Okay, thank you. That's my rant over. Looking onwards, and again, thank you very much, Fiona, for stepping in there. And please, I would be grateful if you'd attend the next meeting with the report, should we not have somebody in place to cover the employability aspect. Item 7, network group updates and resilience. And Angela, you've already been in under resilience, but please come back and tell us more. Again, it's a group I just can't seem to get time to get in with, so I rely on your reports to keep me up to date. Thank you.
Always welcome, Jim. Yeah, Angela Simpson, Head of Strengthening Communities for HIE. Got to introduce myself last time. I haven't got a lot to say. There's a written update, which I think, Fiona, that's going to be circulated. So continue to meet. I think continues to be a supportive network for those organisations which we call anchors across Sutherland that initially worked on the emergency response to the pandemic, but as are there as community organisations supporting their community, delivering a wide range of projects, as we've heard today, from well-being, from walks, from food production to housing. So as I say, a good supportive network. So we've had 3 meetings since the last time. Next one's due at the end of October. We've had 2 focuses, one fairly detailed focus around place plans, which I think we'll touch on again later in this meeting. And at the last one earlier this week, we spoke about subsidy, the changes to state subsidy, which we used to call state aid. I won't go anywhere near any detail about that, but we just wanted to raise the awareness that any groups doing income generating projects, which I know many of them are in order to sustain themselves, just need to be aware of some significant changes which do have impacts on the amount of aid that we can take on that might be considered subsidy. So that's all for me this time, unless anybody's got any questions.
Thank you, Angela. And would like to just pick up on that state aid thing in due course.
No, don't.
Yeah, it's one of these things that makes me worry as soon as I heard that. Sorry, Boyd, please come in.
Just a quick question. Did you mention local place plans?
I did.
Because Caelan Burby has asked me to help them with their local place plan. So maybe we can just catch up at some stage. I'll give you.
Yeah,
I'll keep in contact.
definitely. And I know Scott made himself very familiar with the complex landscape that is the plans that we're working in at the moment, with a good understanding of what it is and what it isn't, and can help through that as well. So by all means.
Thank you very much, Angela. I think this is a good time perhaps to move on to the next item, which is the Southern Community Partnership Project Support Team. And it's got David's name against it, but I'm quite sure that we will pick up on place plans again and get an introduction to what's happening.
I never introduced myself earlier either. I'm David Watson. I work for the Kelly Sutherland Development Trust. As we've heard throughout this meeting, and so the team is obviously Fiona and Scott, with Kelly in the background doing a bit of admin and myself supporting them. The work done moving forward things with transport and homes, which are absolutely key aspects that we have to do, is absolutely fantastic. They're doing a really, really good job. I'm really actually quite proud of them today, actually watching this meeting. Place planning, and I think Scott's going to bring that up in AOB. Are you, Scott, or do you want to bring it up now? But basically, Scott's emailed the group yesterday. I'll just go through and I'll leave Scott to talk through the process that we can help support there. But Scott emailed the group, and place planning is a great opportunity for our communities, and especially, I think, spatial planning at a settlement level, just to make markers in for the community's development plans. I don't think we need to overcomplicate things, but I think what we need to do is not ignore it either, because if we do want to be building more houses, if we do want to be building more places of employment, if we want to be building more leisure opportunities and accessible paths and transport networks, then we have to think about what our settlements need. And Jim's actually done something that's quite genius. He's just done a map embo and drawn on potential places where things could be. That's a conversation starter to get things going. And if you can get community agreement, then the technicalities of flood zones and all that can be worked out as we go along. But I think we have to get moving with that, and I'll let Scott come in a second. As I say, team's doing a fantastic job. The trust seem to be very lucky that we find such good staff living in Sutherland. I think that's a reflection on the place itself, and things work. But the one thing that I will say is that we only have funding for Scott and Fiona for the next 6 months, so we better get a lot of houses built in the next 6 months, or we might struggle. But we obviously are going to be speaking to funders to see if we extend that. There is no secret that the reason the Sutherland Community Partnership is held in such high esteem is because we have support staff, and we have had a number of support staff over the years. And what we don't want to do is go through that period again where we lose staff for 6 months and realise, oh, we should have had staff, and then get staff back and we've lost the continuity. So we'll continue to work with funders on that. I think that's all I really wanted to say. That they're really, really busy. I think those three, apart from the support for the groups, the poverty groups, which are well established and actually just need a little bit of support and run themselves because of the expertise that's in the board, the work that Scott and Fiona are doing with transport, homes and place planning is going to be crucial to the future of the county, and a big important pieces of work. So if we can, if ever they do get in touch with any of you, please try and support them if they're looking for information and if they're looking for anything, because it really is important, and they can only do it with your help as well. So on that, because we've talked about transport and homes extensively, I'll just pass over to Scott a wee bit, who's going to talk about the email he sent out from place planning. Catherine, do you want to come in first?
Hiya, David J, thanks. It was just when you mentioned the poverty groups, I know that I'm Catherine Graham from Social Security Scotland. I'm a local delivery relationship lead that covers the Highlands and Perth and Kinross area. So it was just to ask, the poverty group that you mentioned, I'm aware that there's a Caithness Poverty Action Group. Is this a separate group then that you're talking about, the poverty group that you've just mentioned?
Separate. Very separate. Caithness and Sallins, chalk and cheese. We just don't relate at all. Yeah.
I'm just thinking, I'm not a member of that group, but I probably would want to be, if I could get some details maybe around that, because obviously we do provide benefits and support to make applications for benefits. So
that's a fantastic offer, which I'll take up now.
Jim's the chair of both the fuel poverty and the food poverty group. So so we'll make sure that we get in touch with you regarding that, Catherine.
That'd be perfect. Thank you so much.
Thank you very much for coming in there, Catherine. That's put a ray of light into my life. Thank you.
Scott MacDonald.
Yeah, hello again, everybody. So I've done a fair bit of sort of research and reading about local place planning now. Going back to I attended a webinar, a really good webinar that was put together by Development Trusts Association Scotland. Unfortunately, that was only for development trusts that were able to attend that, but there was only 2 that attended from Sutherland, and I was one of the 2. And it was a really good day, a really good inputs from various different places, community councils that were tackling this subject from like different ways. So some were using a consultation approach, which is obviously very expensive, and people are struggling to find the money to be able to do that in communities. And then other areas were using a non-consultation approach, which I found in particular interest in that type of approach. So I pulled a fair bit of information together. As David said, I put an email out on a Wednesday afternoon, just put it out to all the members of this group. And in that sort of information, there's a really good sheet that we got that breaks down all the different plans, because I've been to various meetings now in my time with the partnership, and people talk about plans, and there's a real confusion about what the different plans are. And I think the document I put out, it breaks it down really, really well. It summarises what each of the plans are and who's responsible, what's community-led, what can be community-led, and what's non-community-led, but there's community involvement. So that's really good. If anybody has a look at that, it's a really good and useful breakdown, and that was put together by Development Trust Association Scotland. I also put in there some information just for further links around the whole subject matter. So the Highland Council website is obviously a good starter for 10. Planning Aid Scotland, there's some really good information on there. They have the place standard tool on there, which some areas have used. It can look quite complicated. It's quite a lengthy document as well. But some councils and development trust have gone with using that tool, some haven't. I added the attachment there, Stratherick and Foyers. They've put together their community action plan, which encompasses their local policing plan. Local police plan. Go back to my old job there. And that's a really well put together document. It's the first one that's been registered with Highland Council. So that kind of gives a signpost as to what will be accepted and be able to be registered. It is a really important piece of work. It's not crucial, but if you want to have your say and have it in time to be part of the Highland Local Development Plan, then they have to be in by the 28th of June next year. So the clock's ticking, and hence the reason why we're bringing this up today. Really need to get behind this in the local areas. Yeah, and I've also put out an attachment to the Kilmarnock Development Trust. That was one of the areas I was talking about. They went with the non-consultation approach, and they've shared a number of useful links that are free. So there's a number of web-based tools that can be used to achieve this. And some of the ideas that have come forward, which I thought were really interesting, was in particular in local areas, consultation is obviously important. You have to evidence, a high level of consultation in the community. It can't just be about the community council meeting deciding or the development trust deciding. It has to be about the community coming forward and saying what they actually want. And through that, there's some sort of pioneering ideas about using like high school children to go round doors and actually survey people, because people are less inclined to turn people away at the door if it's high school pupils that are taking a genuine interest in their area. So I thought that was a really good idea, and that's something that could be considered going forward. But as I say, I've pulled together quite a lot of information about the subject. Just signposting anybody needs any help or anything, looking for any further information, give me a shout. The resilience call through High, chaired by Hyde, they had a number of inputs there. That was a couple of months ago now, and that was really useful as well. Again, there was only sort of limited audience at that meeting, so I do feel that we need to reach more community councils, more development trusts out there, and if there's any use in us putting together further sort of webinars in relation to the subject, absolutely more than keen to pull that together to help anybody going forward.
Yeah, and I think that it's a really comprehensive email that Scott put together on Wednesday, and I would encourage you, if you haven't checked in your inboxes, go and have a check and have a read of that. The best, as Scott said there, the best local community plans for these are led by the community themselves, not done for them. So if you have interest in a community, get moving. There will be support, and certainly myself and Scott and Fiona and people can add support where we can, but we're not going to do the plans for you. But there is loads of templates and loads of stuff that can be done. And I think, Scott, maybe the new community councils coming in might be a good opportunity, and it might be worth hitting them with that similar email as soon as the new community councils are coming in, because that could be a good piece of work for new, fresh community councils who aren't jaded by other things like speed limits and dog poo. So we'll see where we're going with that. But that's I think the update that we have from our side of things. If anybody's got any further questions, just let me know.
Okay, David, thank you very much. Thank you, Scott. And if I can just pick up a point, if we were looking for a working template to go by, then Strategic Employers is through the system out the other end and approved. So they will have the kind of the structure and the headings which will be looked for.
Yes, that's a good example of one that's already been accepted by Highland Council. I'm not sure. I need to check with Kilmarnock Development Trust. They obviously had the non-consultation approach. They were due to put theirs in the middle of the summertime, so I could double check with them how they get on, and that could be another useful example of two different types of approach.
That's good to know. That's excellent. Thank you very much indeed. That's a great piece of work and very, very, very topical for where we find ourselves in a rapidly decreasing timescale. Okay, thank you very much indeed. Northwest 2045 is next in line. Phil, are you up for that one? I thought I saw you coming in earlier on. Perhaps not. No,
yeah, I'm here.
respond.
Sorry,
sorry,
my
Bob.
Teams was a bit slow. Good morning, everybody.
No worries.
I'm Phil Tomlin, I'm a Highland Council Ward Manager. Just quick update on Northwest 2045 then. I have sent a written update. I don't know whether it's been circulated or not. So I won't read it out, but I'll just cover what the main points are. Northwest 2045 continues as a loose coalition. It's still, I think, trying to decide whether it wants to be a more formal partnership or not, and it's trying to get a little bit of funding for some support for 2024. The two main areas of work are repopulation and regional land use partnership. There's already been quite a bit of chat about repopulation, so I won't go into that too much, and Boyd is on the call. Boyd is employed by Highland Council to be a repopulation officer, but his area of responsibility, certainly at the beginning, I think it's been expanded now, was the Northwest 2045 area, so he was very much put into that geography. He's been really busy identifying areas. There's some numbers in the report. 19.4 hectares, for example, of land that's been identified as available for housing. I think what Boyd didn't talk about and Marianne didn't talk about is the work that Boyd does with his colleagues, because there are repopulation officers in the Western Isles and there's one somewhere else, can't remember where, and they are actively engaging with officers and ministers in Scottish Government. So it means that the voice of Sutherland has been heard down in the Central Belt, which is where we need it to be heard. So it's recognised as an area of population stress, and they're listening to it and they're piloting stuff. And part of that work includes, I don't really know why I'm telling this, Boyd should be telling you, but anyway, Boyd has been working with them. The Scottish Government is working on addressing depopulation action plan, and so Boyd is feeding into that. And I think, Boyd, I'm right in saying that that's just very much a first phase and it will go out for much wider consultation. It's something that we should definitely engage with, because I've been involved with various Sutherland partnerships for nearly 20 years, and we've always talked about depopulation, and it's now maybe the time is really to make sure that we keep that very much at the heart of what we do. So we've got to look out for that. The other thing is the regional land use partnership is the second main strand of work. For those who don't know about Northwest 2045, there are 6 main themes for the next 5 years. One of those was around housing and one of those was around land use. And the regional land use partnership is again a Scottish Government pilot. The opportunity came via Highland Council. We bid into a challenge fund, and the idea of that is that it draws together communities and landowners and land managers and develops a land use framework. I think it's fair to say there's a little bit of uncertainty about how much commitment the Scottish Government has to that going forward. We're still waiting to hear a little bit more about it. But what's really important is that the team that we've got working on that, which is based around Rachel Skeen, who many of you will know, but there's one or two other people in there. the idea is to make sure there is some kind of legacy. So whether this framework actually is developed or not, that there will be some legacy from the work that the land use partnership has been doing. And there have been probably 3 main strands that are going on. One of those is the now successful bid, we understand, but we don't have much detail on which is made to Ferns. And this is funding, it's a pilot project to develop ideas and approaches to realising community benefit credits from natural capital. I'm not going to pretend that I understand this, I don't. And I think that the group themselves are, and the project is about developing this idea and seeing how it can work. But essentially the idea is along the lines that environmental and community good can be monetized, and so that people who live out with the area potentially would invest in community benefit and be able to use that on their balance sheets. In one example, use that on their balance sheets to demonstrate how their kind of environmental credentials as a multinational company. So it could be the kind of thing in its kind of most extreme extent. If you ever go on a flight and they say, do you want to tick this box and give us £1 and we'll buy some carbon? There are those kind of schemes that go on, but there are others that are a little bit more philanthropic, and there is a potential to develop some models around that. And so it's really, really difficult. I don't understand the detail. It's quite difficult to grasp, but that's the kind of thing that they're working on. So hopefully, you know, there will be opportunities for people in this table around in this room to engage with that, and for us to learn things for all our communities. But it might actually, I think it's trying to say that there might actually be some value, some monetary value in, you know, in being a fairly kind of pristine environment. So there's a lot there. They're also working on a project which Boyd has also mentioned, which is the work in Kinloch Burvey. It's called Land Plus, and this has very much mirrored the work that we did as a community partnership in 5 localities. In this case, they're just working in Kinloch Burvey. But I think what's interesting this time is that it's rather than, I think last time the locality plans, we kind of did it a little bit top down from the core partners. This is much more community focused, and it kind of ties in with what Scott was saying there about, and others today, about the importance of the community being at the front of plans that are done for them. So there's that work going on, but I think the kind of interesting thing there is that it isn't just about, it comes from a kind of land angle, and the idea is to try and get landowners and other land managers involved, perhaps in a more fundamental way than we do sometimes with our kind of inequalities and well-being focus, which we tend to kind of focus on the partnership. So some interesting stuff again there, hopefully that'll come out of that, and it's great that Boyd's involved with that, because that'll mean we've got a strong tie-in with that through him. And then just finally, the RLUP continues to engage with the Scottish Government. Finally, engagement around there's engagement work that continues. The one thing I think to flag is the Royal Islands Parliament in Fort William, which is coming up next month, or sorry, November. So there are some people from Northwest 2045 going. I believe Richard Gale is going as well, so there will be other people around. I think there was an opportunity to attend all or part of this 3-day jamboree online, and I would encourage people to get involved with it, because there is, you know, we can register for some of the events and don't have to go. But Fort William's not that far away if people do want to go. You know, there are opportunities to be involved with visits. It looks like a really quite interesting programme, but even if people don't have that time to invest, we do have representatives from Sutherland there, so make sure you kind of chin them and make sure that they speak highly and advocate for our issues. But as I say, there will be opportunities for people to join remotely and join the discussions and sessions. Sorry that was a bit long-winded. There is a written update which you can read. Thank you very much.
Thank you, Phil. That's very interesting indeed. And I must admit, when I heard community benefit from natural capital, I immediately thought golf course, but we'll see if that fits with the pattern that they want. Fiona, do you want to come in there?
Yes, I just wanted to say that I haven't circulated the written updates yet. I was waiting for one or two to still come in, but I will put them out with the presentations from today.
Right. Thank you very much indeed. Boyd, would you like to come in there on anything that Fuller said? Good to have you here.
I guess it's worthwhile to say I'll just share one graphic that was in the report because it shows where the oops, that's the wrong one. That's the wrong. Oops. There you go. That's just showing where the community assessment officers are. This is a COHI project. So we're covering the Highlands, Uist, and Argyll and Bute. Argyll and Bute, it's really quite spread. It's Bute, it's the Kintyre Peninsula, it's Rosneath, and it's Tyree and Call, whereas it's Uist and Benbecula for the Western Isles, and myself, I'm here in Northwest Sutherland and Coech. So that's the area that I'm covering for there. And with the Scottish Government, they're producing the ADUP, which is the Addressing Depopulation Action Plan, that should be coming out in December, because myself, my colleagues who are doing the repopulation settlement officer work were one of the first projects to address repopulation that was being funded by the Scottish Government. We were asked to present to it and have had an insight into it. They've initially been having discussions within the agencies of the Scottish Government and then more widely with COSLA. So I know each of the individual local government areas have been inputting into the first draft. I believe the second draft is coming out soon, but I don't know how many details on. I don't have any details on how far it might be circulated. But I would recommend that you perk your ears up if you do see something coming into your inbox. It's not an easy read, but I think it's very important to have that input.
That's excellent. Thank you very much indeed, Dan. Any questions or comments for Boyd? Just to keep up the good work, Boyd. Thank you very much.
Oh, sorry, I should say I got extended by a year. At the last meeting, I said I was waiting for extension.
I must admit, I did actually put in an email of support for your position and hope that it would actually keep going, because there's no point in stopping the job now. There's much more to do.
Thank you very much for that.
So I'm delighted to hear you're still there. Thank you. Okay, in that case, if we can finish with item 7, we're on to general, not too bad for time either, community matters and any other business lumped together. Anything coming forward from any of the attendees today? David?
Just a couple of very brief things. Marianne alluded to earlier, and since Marianne spoke, we've heard a couple of mentions of other organisations that are working on similar type stuff across Sutherland, like Focus North and Northwest 2045 and Green Freeports and stuff like that. I think one of the aims we have to do is get better at actually not just hearing what people are doing, but working together. So that's going to be one of the things that we're going to be pushing for in the next little while. The other thing that I wanted to say is that Gail Prince, who used to work for the Trust and work for the Sutherland Community Partnership, and if you've ever met Gail, you'll not have forgotten her. She's now the Partnership Development Manager for the Highland Council, looking at community planning right across the area. And one of the officers that she's got in her team, Jane Young, I think, is on the call today. And what it's going to be looking at is looking at community planning, trying to actually, I think, is trying to bring some of the other areas that don't function as well, as Stuart alluded to earlier, to try and make sure that there's a minimum standard. So we'll be seeing interacting with Jane a lot on that. And what we have to ensure at a Sutherland level is we don't get brought down so that we're equalised. We have to keep delivering and keep doing things well. But I think Gail and her team will be doing an excellent job. And I genuinely couldn't think of anybody better to drive it forward than Gail. I see Jane's come on there. Do you want to say anything, Jane?
David, thanks for the introduction. Just wanted to say hi. It's great to see everything that's going on. Absolutely fantastic work across the partnership. So yeah, keep up the good work, and I'm just excited to be working alongside you.
Thank you very much, Jane. And if you know Gail as I know her, I think a force of nature is the term I would use. But going back to our current forces of nature, I am deeply alarmed that we have only 6 months. I cannot imagine life without Fiona and Scott. Things will just not work without them. So I think we have to make every effort to get the funding in to get these contracts extended. And whatever we can do, we must do. Anybody else want to come in at this point for any AOCB? Phil, floor is yours.
Yeah, thank you. Very briefly, Community Council are open for nominations, and closing nominations is 3rd of October. We still have some holes that need filled. So please, if you know people who are interested and want to get engaged with the local community council, the stuff's on the council website, and the deadline is Tuesday, 3rd of October at 12 noon. I've also put a link to the Royal and Islands Parliament in the chat.
Thanks, Phil. Are the list of applicant names for the election in the public domain, or is that kind of subject to GRTB and we won't know until we actually see the ballot papers?
Yeah, the list of people who put themselves forward only gets announced after the close of nominations, unfortunately.
Yeah, well, unfortunately, I think is well made. Yes, it's something that perhaps could perhaps we've done better than the other way around, but never mind.
I would add, Jim, just quickly, if there is an opportunity to withdraw, so if people, often people say I'll stand because they want to make sure it forms. There was a week to withdraw your application afterwards, so actually people can put it in if they see that there are more people than are required. Sometimes people do withdraw, so that opportunity is there. You can do it that way around. Obviously, we don't want people to withdraw. We'd rather there were elections. It makes the community councils more representative.
Far better if there's an election. Yes, there's a mandate that goes forward with each individual that's elected in that case. Marianne?
Just a wee word to agree with everything you said about Scott and Fiona's positions, but also wider than that in our other development trusts in the area. There's lots and lots of people on this call, so if anybody has anything they can do at all, just an appeal to do that, because we're hugely dependent on our development trusts and all the work they do.
And they are dependent in turn on funding which comes in part from wind farms. So yeah, we just have to work with what we've got. Yeah, but it's a point well made. Thank you. Okay, in that case, if we have completed and it's heading for lunchtime for those that like a 12 o'clock lunch, then we are on to date of next meeting. Now, are attendees content with Teams, carrying on with Teams? I think there's a great value in having Teams. There's a value in having face-to-face. There's a great value in having Teams and having people that can sign in from all over, such as Catherine, if I may. I'm just looking at you at the moment, Catherine, sorry. But just it means that people can come in from all over and actually attend, or perhaps I don't know to what extent hybrid is possible. But certainly Teams seems to be cleaner and gives us everybody a chance to come in. So it's something I'll leave with. These are your meetings, so I will leave it with you to decide what you would prefer. But at the moment, Teams works well for me. Okay, Marianne, so you want to pick up that point in the chat? No, doesn't suit everybody, obviously.
It was just to say, no, it wasn't on that. It was on what you said about we're all dependent on wind farms. Some of us poor souls don't have a wind farm.
Wind farms. Sorry, sorry. I should have corrected myself. You're quite correct. Your wind farm shadow is the term I use actually. Yes, and it is very difficult to. Well, and Embo, I share that with you. Embo is wind farm shadow as well. We'd have no kind of wind farm of any substance upon which we can call, and it's hard going. It's hard going. You're trying to make money out of thin air to try and support initiatives. And when you have sharks like SSE desperate to take the money off you, such as you have, then it doesn't help the overall prognosis for our futures. Okay, the next meeting is 1st of December, and if it's okay, we'll go with Teams again in that case, if there's no major kind of call otherwise. Okay, well, thank you very much. I think it's been a very valuable meeting, some valuable contributions. And Catherine, you're based in Inverness and happy to travel. We'll bear that in mind. Yeah. We'll also think of our carbon footprints as well. Well, thank you very much, everybody. And on this dot of 12, as we are here, so I'll thank you again for attending and your contributions. And I hope you have found as much value from it as I have. So it's good to see you all again. So see you later. Cheers.
Thanks all.
Thanks, Jim. Cheers.
Thanks, Jim.
Thank you. Bye. Bye-bye.